Now, let us look at the complications we get when we have diabetes mellitus. Complications of diabetes mellitus. These complications are subdivided into two majorly because when you get diabetes mellitus, in most cases, you will get problems with the vascular system, the cardiovascular system, whereby what are we meaning here? When you have diabetes mellitus, you find that there's too much blood in there's too much blood sugar in your body. So in the circulation, there's too much blood sugar. They cause problems to the big blood vessels, and also they cause problems to the small blood vessels. The problem they cause in the big blood vessels here, we term them as the macrovascular complication, or we can say macrovascular diseases. It can be macrovascular complications or macrovascular diseases, or you can call it macroangiopathy. You can say it's macroangiopathy. So here it's almost the opposite. Here it is macrovascular complication. Here in small blood vessels we get microvascular. Complication is or diseases. Or you can say microangiopathy. Microangiopathy. So these are the complications, the problems. Usually these complications, these are the problems we get, and they become ours for a long period of time. So it becomes a lifetime problem to us, as we are going to see, because 75% of the people who die of diabetes, they die because of the cardiovascular problems. And these are the cardiovascular problems we are going to talk about. Let us see. If you get problems with the big blood vessel, which we call macrovascular complication or macroangiopathy, you find that you will get problems like coronary artery. This is card, which is coronary artery disease. You get coronary artery disease. So when you get this coronary artery disease, you find that you will get what we call heart attack, or myocardial infarction. So you can also get the cerebrovascular disease. This cerebrovascular disease, a problem that attack a blood vessel that is supplying the brain or any other part of the body. But when there is a problem, what you should know is that a good, a good and normal blood vessel will be like this. So blood flows through this blood vessel very well in the body and takes the blood to the various parts of the body. But now, the one we are talking of, which has been affected by the diabetes mellitus person, is that these people with diabetes, too much glucose will start making problems like depositing the things, depositing the deposits on the walls, inside the walls of the blood vessels. They will even reduce the space of the blood flow in the blood vessels. So, in the due course, sometimes these deposits inside the blood vessels can detach a smaller part. A smaller part can get detached and it starts moving in the saturation. So it moves in the saturation. Now, in this case of the cardiovascular disease, it will move and block, and it will reach somewhere in a smaller part. It will reach in a smaller part and it gets stuck there. Now, this smaller part is the one now taken to the brain. It will get stuck like here. So blood will no longer reach this part of the brain, the other side where the brain is. Hence, leading to conditions like a stroke. Stroke will come in because that part of the brain is no longer controlling the where it is supposed to control, because it is not receiving oxygen. That part will die away. So that's why you'll find that people they have problems with lifting the leg, lifting with talking, lifting the tongue, or even problem with what? With the leg or the hand. So that is a cardiovascular disease, how it comes in. So there's another type, which is the peripheral arterial disease. This peripheral arterial disease will come in because the lower limbs are not receiving enough blood supply and there is no oxygen being received in the lower limbs. So, this will sometimes lead to even amputation. So you find that the person's leg will be cut off to make sure that this person feels better. Yeah. So that is it with a defect in the blood saturation problems we get with it. That's it. Let us look at these ones, because we say it can cause problems to big blood vessels, which we call macrovascular complication or macroangiopathy. Then it can also cause a problem in small blood vessels, and these small blood vessels, when they get problem, we call it microvascular complication or microvascular diseases. What are these microvascular diseases? It can affect the blood supply or the oxygen supply to the eye or the retina. So it will lead to retinopathy. This will lead to retinopathy, and sometimes you find that there is growth of cataract. Sometimes also you can see there is glaucoma. The problem with the retina will lead to blindness. Somebody will become blind because of this problem, retinopathy. Then someone will get nephropathy. This is when there is a problem in the saturation of blood or oxygen to the kidney nephron. So you find that this person will even get kidney failure. This leads to kidney failure. And most of these people, about 50% of the people in dialysis, they go for dialysis because of this problem, nephropathy, due to diabetes mellitus. So the 50% of this population who are on dialysis are there because they are on dialysis just because of this problem. Then there is another third problem which comes in as a result of the microangiopathy. Another problem is that there is neuropathy. There is neuropathy. Now, this neuropathy, you find that the person, this is destruction, because there is no good supply of blood with oxygen, or blood or oxygen. Once you don't receive enough blood, then the oxygen is also not enough. So this is when the supply of the blood and oxygen is little to the parts of the neurons. Neuropathy comes from neurons. Neurons, these are the building cells of the central nervous system. So this central nervous system, once it is affected, it will lead to problems like there will be loss of sense. So sensory loss. There is sensory loss. There is sensory loss. That's one. Two, we shall have neuropathic pain. Then also, the third one, after neuropathic pain, we shall have autonomic dysfunction. Dysfunction. Here, in autonomic dysfunction, you will find that there will be problems like pollen, there will be problems like posture, hypertension. There will be a problem with the posture, hypertension because of this autonomic dysfunction. So you find in the posture hypertension, what do we mean here? Posture hypertension is that when you are lying down, blood is flowing at a certain steady pressure, with a certain pressure, facilitating the movement of blood from the legs, the feet, to the heart, to the head, to the heart, down like that. So when you sit, the body has to maintain the same pressure. And when you stand, the body has to maintain the same pressure. But you will stand and the body will not be notified because there is a problem in this messenger, in the messenger, which is the neurons. The neurons, they have problems, so you will not be notified. The body will not be notified that you have changed the position, so it should maintain the pressure, should find a way of maintaining the same pressure. So you find that you are standing, but you get hypotension. So as a result, you find that this problem comes in. So another problem you can get with this neuropathy, is that because of autonomic dysfunction in neuropathy, you find that there will be diarrhea. Diarrhea will come in. Also, you'll find that you will you will you will get erectile dysfunction. Dysfunction. So you get posture, hypotension, diarrhea, erectile dysfunction. This is because of this autonomic dysfunction and neuropathy. So these are the complications which we can mention because of this. Others can be other complications. Other complications. You can find there is hearing loss. There is hearing loss. Then there is falls. There is falls in adults, especially in adults. Then there is cognitive problems. There's cognitive problems. Then there is also dementia. Dementia will come in. And then we have gallstone. Most of these problems, they happen just because of the way I've explained. The problems which come to the blood vessels, they lead to all these problems. They cause these complications to happen on somebody suffering with diabetes mellitus.